So the warning signs of stroke may include the sudden onset of numbness, weakness, or tingling, especially on one side of the body, a sudden change or loss of vision in one or both eyes, the sudden onset of dizziness or incoordination, inability to walk, the sudden onset of difficulty speaking or understanding speech, or the sudden onset of an unusually severe headache without ever having had one before. So that's a lot of different symptoms to think about. There's a helpful tool to help people think fast about stroke. FAST, F-A-S-T, face, arm, speech, and time. So if you think that somebody might be having a stroke, you can ask them to smile to see if their face is symmetric. You can ask them to hold their arms up in the air like this, and if one of them droops down, then that's a problem. You can ask them to speak, or ask them a question, or ask them to repeat something. So if their speech is garbled or slurred, or they don't seem to understand what you're saying, their speech is affected. If any one of those things is not working right, then time is of the essence. So F-A-S-T. If you think somebody might be having a stroke, remember to act fast. Call 911 and get the patient to the emergency room right away, because there's treatments that can help stop a stroke in its tracks.
Okay.
Most strokes are caused by a blood clot that's plugging up an artery in the brain. If we can open up or get rid of that blood clot and reestablish blood flow before permanent damage occurs, sometimes the stroke will go away. The longer the stroke is going on before it gets treated, the larger it will be. So if we can get rid of that blood clot soon enough, we can limit the damage that the stroke causes. It turns out that there's a medication called TPA, which is a clot buster, which will dissolve a clot and stop that stroke before permanent damage occurs. But what we found out is that permanent damage begins right away, and after somewhere between 3 and 4.5 hours, there's no longer any benefit to the clot buster. So we have to give it within 3 to 4.5 hours of symptom onset. After that time frame, the medication is more likely to do harm than do any good.